The first signs of liver damage from alcohol can be very subtle. In general, patients don't experience any symptoms until they've had fairly progressive disease with lots of scarring. The classic symptoms of acute liver damage from either alcohol or viruses are fatigue, intense fatigue. People sleep many hours. They actually can't get out of bed sometimes. Fatigue, anorexia, they don't eat as much. They may notice that their urine is very dark and tea-colored, that their skin begins to turn like yellow, particularly the eyeballs, the whites of the eyes turn yellow, right? And that the stool turns very light and clay-colored. That's the classic set of symptoms for acute hepatitis. Okay, for alcohol, for early alcoholic cirrhosis, fatigue is probably the most important sign. So if you're having more fatigue than you had previously and you've been drinking heavily, right, that would be your first moment. If your urine is getting dark and tea-colored, or you're noticing a little yellowing in the sclera, the white of the eyes, that you need to bring that to your doctor's attention. Some people present with something called ascites. They have abdominal fullness and swelling. There's fluid in the abdomen. And that's because the scarred liver, the fluid can't go through it as well, and it just sort of gets pushed out, like it extravasates into the abdominal cavity. So if you have this tense, distended abdomen, fatigue, maybe a little yellowing of the eyes, your doctor needs to see that right away. But the earliest symptom is fatigue.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.